the purpose of this event is it's part of a cooperation, which I hope will go on for many years, between us and Advice NI. For those of you who don't know us, we're an independent think tank based in Dublin, and we look at issues related to inequality and democracy in Ireland and the EU. And I'll leave the welcome for Advice NI up to Fiona and the staff, but this is a Community Foundation of Ireland funded event for cooperation across border. And we're looking at, in our project overall, how to support the most vulnerable groups post-pandemic. We've moved now from the pandemic to a cost of living crisis, partly engineered through supply chain difficulties and the war in Ukraine, but also long-standing structural problems, for instance, regarding housing or the cost of food, the cost of rent, and in the Republic of Ireland, a significant low-paid domestic economy where people just don't earn enough in order to afford a decent quality of life. So the event, this discussion today is not just about the current problems, which are very important, but also about long-standing structural problems. So how can social welfare policies and how can social policy more generally respond to these issues that are affecting particularly the most vulnerable and socially marginalized groups in our society? Just a couple of I won't do the fire exit because obviously we're online, but I have a couple of other sort of little things I'm supposed to mention. Obviously, the main speeches are being recorded. If you've just gotten the announcement, the breakout sessions will not be. We want you to speak freely and benefit from the discussion. We will be attempting to write a policy brief that will come out in September. That is a result of the overall project. This is the second of two events. The first event was a couple months ago, and we will send you, all of you, a link to the report when it comes out. If you could all put your full name on the screen so we know who you are, not just your organization, but your name. And if you could introduce yourselves when you go into the breakout session, that would be fantastic. The last thing is the breakout sessions will not cover specific topics. They'll cover general themes so that we can encourage more wide-ranging conversation. Anyway, I will now be quiet because I want to get on to the event. Janine Maher is up. She's from the Money and Pensions Advice Service, but she'll explain more in depth what her position is. She will be the first of our speakers this morning. Thank you again for joining us.
Thank you. I'm going to just try and share a screen. Hopefully this will work. Does that come up?
Yes, we can see it, Janine.
Brilliant, thank you. Thank you very much for inviting me along today. It's great to come and share with you some of the work that MAPS has been working on the UK financial wellbeing strategy. My name is Janine Maher and I'm the Northern Ireland Manager for Money and Pension Service. And I'm just going to give you a very quick overview on the strategy and the delivery plan for Northern Ireland. Very conscious as the first speaker not to go over my time because that knocks it out for the rest of everybody else, but I'll be as quick as I can. So who are MAPS? MAPS is an arm's length body of the Department of Work and Pensions funded by a levy on financial service. We have been in and around for about 15 years. And we have had a number of different iterations, but within the past couple of years has become the Money and Pension Service, bringing together existing brands of the Money Advice Service, PensionWise, and the Pension Advisory Service. MAPS has a consumer-facing brand, so this is what people engage with, called Money Helper, and this is very much a one-stop shop for money guidance through to debt advice and pensions guidance. And just for context, the Money Helper website and all of our channels since the 1st of January this year has had around 9 million.
Do you want a charger?
Sorry.
Can everyone other than Janine please go on mute? Just because we're hearing some noise in the background, it's making it difficult to hear her a little bit. Thank you.
Thanks, Fiona. So since the 1st of January this year, the Money Helper website has had 9 million hits across the UK with 7 million individual users. And for Northern Ireland specifically, we've had 135 sessions and 108,000 individual users. So there's quite a high usage on our services in terms of trying to bring money guidance to the fore. So just what is the strategy, as well as delivering our own services for money guidance. MAPS has an overall arching strategy for driving up levels of financial well-being across the UK. And for us, what this means is having a financially healthy nation that everyone's making the most of their money and pensions. And I will pop into the chat later on links to the strategy and links to the research that have brought all this together. But essentially what we have devised is a strategy that has 5 core pillars, 5 agendas that we wish to drive and change in, and I think that will have a massive impact on financial levels of financial well-being across the UK. Those 5 agendas for change really start with financial foundations. This is around giving our children and young people firm financial foundations so that they're equipped when they become adults to make the most of their money and pensions and make those decisions. So this is around financial education. Nation of Savers is very much focusing on our working age, struggling and squeezed people, and we do provide information on our segmentation in the strategy. This is around driving up levels of resilience across the UK by facilitating and encouraging people to save more regularly. Credit Counts then is focusing on driving down the numbers of people in the UK who are using credit for food and bills. Fourth one is around driving up the number of people that are accessing debt advice, and the 5th is looking at how people are engaging with and are prepared for the future and informed about that. Now, we developed all of these agendas pre-pandemic, and that was very much what could we do. We actually just published the strategy about a month before COVID hit. So we were very much, all of our evidence base was focused on a pre-pandemic world. So we very much pivoted at that point in time to focus on what people needed in terms of crisis guidance and money guidance in the pandemic, and focusing on how people were using their household income and accessing all that they were entitled to. So we are very much in a position of shifting to the needs of people, but we still want to keep these agendas for change over the 10-year strategy because it is a longer term goal. What those priorities mean for Northern Ireland is around driving up levels of financial foundations, of 60,000 more children and young people getting a meaningful financial education, and you can see there on for the rest of the agendas what we mean for each nation. And looking at the state of play in Northern Ireland, you know, our strategy was developed on our financial wellbeing, financial wellbeing survey, which was done in 2018. We've just done another one for 2021. What is the state of play in Northern Ireland? So what we can see from our research, that 52% of our working age struggling and squeezed are saving. So, you know, although that has gone up 3 percentage points since the baseline in 2018, that still means that 48% of working age struggling and squeezed people in Northern Ireland aren't saving on a regular basis. And 13% of people in Northern Ireland are often using a credit card overdraft to borrow money to pay for food or bills because they've run short of money, and that's gone up 2 percentage points. 12% of people in Northern Ireland are in need of debt advice, and 36% of the population in Northern Ireland, only 36% of the population understand enough to plan for in their later life. So this very much, again, this research was done before the current crisis that we're in, and looking in terms of energy and the cost that that's going to have on household incomes. And I saw a piece of research this morning showing from Credit Connect that energy spending has gone up 28% since April last year. So if we were to redo this survey right now, I'm sure we would find an impact on all of these figures. So it's just for context that we're constantly trying to monitor and understand how people across all 4 nations are impacted on their financial well-being. So in order to develop our delivery plan for Northern Ireland, we went through a process of virtual roundtables. Obviously, COVID impacted on our ability to meet face-to-face. However, having an opportunity to use technology meant we were able to engage with a lot more people because people were able to attend virtual roundtables. MAPS established 10 UK-wide challenge groups. So that was looking at all of those agendas across the UK, and there was representatives from each nation on the UK one. Following on from that, we also had a series of roundtables in Northern Ireland looking at each of these agendas of change and workplace and mental health. We actually have cross-cutting themes within those agendas, looking specifically at the workplace as a route to providing information to people. We looked at the implications for financial well-being on people with mental health issues, and we also covered gender because there are specific financial well-being issues for women. We had over 90 individuals from across 35 external organisations attend those, and we had two separate rounds of engagement looking at short-term COVID response, and then medium term, how do we rebuild people out of the pandemic. MAPS as a UK-wide organisation is very cognizant of the fact that delivery across each of the nations is different. The policy context, the issues in each nation are different, but there are core themes that run throughout all 4 nations. So we have produced delivery plans for each of the nations of the UK. The Northern Ireland delivery plan then is sponsored by the Department for Communities, and we've worked very closely with Department for Communities colleagues to ensure that what we're focusing on meets the policy agenda and works alongside the policy agenda from the Northern Ireland Executive. And in fact, the Minister, I see Michelle Loughran's going to be talking later on about the anti-poverty work. The Minister sees this going hand in hand with the anti-poverty work that she's leading on. We published the Northern Ireland Delivery Plan just in April. Unfortunately, we timed out for ministerial sign-off just before the elections, but we are waiting for a new executive and a new minister to be formed in order to take this work forward. We have a forum in Northern Ireland which is due to meet on the 14th of June again, and we try and meet quarterly, which really helps shape and move forward on the issues and the work in Northern Ireland. But a very quickly one of just 3 pages, and again I'll put links to the delivery plans, you can see all of it. But 3 pages here on the kinds of activities. There are 26 activities listed in the delivery plan across all of those agendas for change. Now, what I'm hoping over the weeks and months ahead that we'll be adding to these list of activities from other stakeholders. This is very much focused on what MAPS is doing and what's happening across government. So I just wanted to give you a very quick overview of some of those, and also the key partners involved in the delivery, because MAPS is very clear that in order to drive up levels of financial well-being across the UK and in Northern Ireland, we have to work very much in partnership with key players, many of whom are on the call today. This is a shared issue that we all need to work collectively on in terms of addressing. So in terms of financial foundations, what we're focusing on, there's 5 activities so far. Your Money Matters textbook is a textbook that MAPS has funded with Martin Lewis, which has been matched to the Northern Ireland curriculum, and it's very much focused on teaching our young adults on managing money, and that's been distributed across all those schools in Northern Ireland. We have a programme called Talk, Learn, Do, which is very much looking at supporting parents talking to their children about money. We've developed that as an interactive delivery, but obviously COVID impacted on how we deliver those things, so we're focusing on how we can do that in a digital context. We're also expanding Talk, Learn, Do for teenagers. So how can you talk to your own older children about money? We're looking at teacher training, and we're also supporting looking for work to support practitioners for children, vulnerable young people. In terms of Nation of Savers, we're focusing on payroll savings, a savings charter, and help to save as a means of driving up levels of people that are saving in Northern Ireland and building their financial resilience. And the Irish League of Credit Unions are working very closely with us and a number of employers to pilot a payroll deducted savings, and we're really, at the moment, we're having that evaluated by the Behavioural Insights team to look at the impact of payroll deducted savings. Credit accounts then is looking at things like access to affordable credit, supporting victims of illegal money lending, income max, and also things like credit standards for those with mental health. So those are some of the initiatives that we're working on. Better debt advice. Debt has devolved to the Department for Communities, so a lot of these initiatives are led by Department for Communities, and they're focusing on increasing awareness and access to better quality debt advice, looking at how we can implement breathing space and the debt respite scheme for Northern Ireland, and looking at how we can broaden debt advice referral partners. And in terms of future focus, MAPS is focusing on building a retirement planning hub, a midlife MOT, and specific guidance for women and diverse ethnic communities. And then we are again, there's some very broad cross-cutting themes here, such as our Money Guiders program, which is we have a network that we've developed in Northern Ireland, which is there to develop skills, sharing, understanding, and research and training across the Money Guiders in Northern Ireland. So there's a lot of different activities looking at trying to support people in terms of delivering money guidance and accessing debt advice and pensions guidance. For the delivery plan, we intend to produce a progress report for each nation. So there'll be one published twice a year. The first one will be October of this year and then April next. And we're going to update on each activity in the plan in terms of how it's delivering and what's contributing to the overall goal. And we also, as I said, want to really start capturing any new activity, both that MAPS is developing from our governments and also from wider stakeholders. And also the progress report gives us an opportunity with our forums across each nation then to look for, identify any gaps and also emerging issues, because if COVID has shown us one thing, it's shown us that we have to be able to respond to the needs of the people that we're working with. So that is a very, very quick overview of the financial wellbeing and delivery plan for Northern Ireland. And I'm not sure there's time for any questions, but if you have any questions in the chat, please drop it in, or maybe be around for the session later on. And hopefully I haven't gone over my time. Thank you.
Thank you, Janine. Sarah, do you want to take on there who's up next, or is there time for questions?
No, I think we'll leave questions there until the end. But I think it's Helen, Dr. Helen Johnson is up next.
Good morning. Can people see the screen?
Yeah, I can see the screen there.
Two things. Can people hear the screen, and can people see the screen, and can people hear me?
Yes.
Okay. All right. Good morning, everyone. Thank you. So I've been asked to speak about the wellbeing framework in Ireland. So I'm going to just run through these slides. So just to give a little bit of background, people probably know this, but wellbeing really has come to the fore as a measure of progress that is more than GDP, which tends to focus on economic issues. So wellbeing is trying to take into account more kind of social and environmental issues as well. So broader measure of progress. And in Ireland, TASC was asked to produce a social report for Ireland actually back in 2009. And so I was tasked with that, and I looked at social issues, and wellbeing really was coming to the fore at that time. So we published a report on Wellbeing Matters, which kind of discussed the issues of what should be in a wellbeing framework and what kind of indicators and so on should be used to measure that progress. But at the time, of course, that was just after the economic crash. So it was kind of a slow burner in that people were concerned with austerity at the time rather than measuring these kind of wider measures of progress. But at the same time as well, we had the Stiglitz-Sen-Fitoussi Commission, which was set up by the French president at the time, Nicolas Sarkozy. And they were looking at these very same issues of what are measures more than GDP, and what are the environmental issues and so on. And that was quite a high profile report given the individuals involved. So that did kind of stimulate a discussion on well-being at the time. And then for Northern Ireland, the Scottish charity Carnegie UK Trust put in some money into Northern Ireland as a kind of a UK-wide organisation. And they set up a roundtable on measuring well-being in Northern Ireland. And they had a lot of, they worked with Queen's University at the time, and they had individuals, public servants, business people, community people, environmental people, so on this roundtable. And they undertook consultation as to what should be in a wellbeing framework for Northern Ireland. And it was accepted or they worked with the Northern Ireland Executive at the time, and there was a draft programme for government produced with this kind of outcomes, wellbeing outcomes focus in 2016. But of course, then the Northern Ireland Executive fell in 2017, so it never really was realised. But there was the preparatory work done at that time. It was really trying to move on from the kind of conflict and the two communities approach that had been present in Northern Ireland to a more all-encompassing wellbeing approach. And then all of this time, the OECD have been doing a lot of work on developing wellbeing frameworks and indicators. And they in fact now have a centre on wellbeing, inclusion, sustainability and equality, and they have a Better Life initiative, and they produce these house life reports which compares well-being across countries, but also then has more detailed reports for individual countries as well. So they're kind of leading the way in thinking about well-being frameworks, what should be in them and how should they be measured and so on. Okay, so that's just some background. If we come on then to the wellbeing framework for Ireland, there is a commitment in the current programme for government, which was agreed in 2020, to create a set of wellbeing indicators for use in driving policy and evaluating outcomes. And so in order to try and deliver on this, a departmental working group has been set up, and that's led by the Department of the Taoiseach, but also in partnership with the Department of Finance and the Department of Public Expenditure and Reform. And they have included then departmental representatives from across government departments in Ireland, and they've also included actually the National Economic and Social Council and the CSO, Central Statistics Office. So they've been doing work across departments as to what should be in a wellbeing framework and what indicators should be used and so on. And it's based very much on the OECD work in terms of the starting point for the framework. And as part of this work, the National Economic and Social Council that I work for was asked to undertake a consultation on wellbeing to kind of inform what should be in the framework itself. So last year we set up a stakeholder and expert group, and that met on a number of occasions. We undertook interviews with stakeholders, experts and social regional actors. And then we also undertook an online survey with organisations and across our kind of social partners that make up our council and other community and voluntary groups and so on. So from the online survey, we got 450 responses as to what should be in a wellbeing framework. And we analysed that information and produced a report for the departmental working group led by the Department of the Taoiseach. So our work concluded that there were three overarching and linked priorities, and one of these was equity. In other words, we should try and have a fair and equal society. Also agency, that the importance of engagement with citizens in identifying priorities and having a view of what should be the best life for themselves. And then the sustainability, that we need to think not only about the short term, but also the long term and the trade-offs between the short term and long term goals. And it's interesting that Wales, for example, has a Future Generations Commission where they're very much focused on what should be in a, the measure of progress for the future. So then on to what's actually in the wellbeing framework in Ireland. So the Department of the Taoiseach published the first report on a wellbeing framework in Ireland in July 2021, and you can download that from the government website. So the aim or the vision was to enable all our people to live fulfilled lives now and into the future. So they're kind of trying to capture both present and future. It really consists of a conceptual framework as to what a well-being means to people, and then there is a dashboard of indicators to measure progress over time. So there's 11 dimensions. This is based very much, as I said earlier, on the OECD framework. So the Irish framework has 11 dimensions. I'm just going to read these out quickly. I'm not going to go into them, but if anybody wants more information on them, I'll talk to them in the discussion group afterwards. So the 11 dimensions are subjective well-being, how you feel about yourself, your mental and physical health, your income and wealth, your knowledge and skills, your housing and the local area, environment, climate and biodiversity, safety and security, work and job quality, time use, community, social connection, cultural participation, civic engagement and cultural expression. So that's really just in a nutshell what's in the Irish Wellbeing Framework that was published last year. So what's happening now is that at the end of last year, towards the end of last year, the Department of the Taoiseach undertook consultation on their framework to see what people thought of it. They had an online consultation process. They undertook focus groups with the public participation networks, which are a kind of a local voice in local authorities, and also with young people as well, focus group with young people. So that information has been considered in the context of the draft framework. There may be some relatively minor modifications, I understand, particularly maybe around some of the cultural factors that affect people's lives, and they're due to publish a second report this summer. At the same time, in NESC, we have been undertaking further work as well, looking at embedding well-being into policy making. And there we've been looking at international examples about how that has been done, specifically Wales, Scotland, and New Zealand, as well as an Irish example as well. So there are different ways in which well-being has been embedded into policy making. For example, through the budgetary process, as is happening in New Zealand, through legislation, it's happening in Wales, and then an outcomes framework, which is the Scottish approach. So that is due to be published sometime this summer as well, and it is informing the work in the Department of the Taoiseach. So then I just wanted to say a little bit about, I think I still have time to say a little bit about what is happening in Northern Ireland. So I explained earlier about the Carnegie Queen's roundtable to influence the programme for government there back in 2013 to 16. And then Carnegie wanted to do some follow-up work there, but of course the executive was suspended in 2017. So they took an approach to work at a local level rather than at national level. So they set up an advisory group of some of the people who have been previously involved. And also at that time, there was legislation passed to undertake community planning and set up community planning partnerships in local authorities. And they thought this was a good model to try and incorporate a well-being focus. So they invited applications from the various local authorities, and 3 then were selected for some financial support. Now, those were Armagh City, Banbridge and Craigavon Borough Council, Derry City and Strabane District Council, and Lisburn and Castlereagh City Councils. But there was also peer support provided to other local authorities as well. So there was kind of a network for them to learn from what was happening, and there were study visits and so on. But the main focus was really on co-production and shared leadership. In other words, how can we engage citizenship really in terms of trying to determine what their well-being might be through the community planning process. So there was a report then published by Carnegie in September 2021 called Working Together for Wellbeing, which outlines the processes and the outcomes of that. So then just finally, part of my work over the last year or so has been looking at the Shared Island initiative that is being promoted by the Department of the Taoiseach as well. And as part of that work, we've looked at economic, social and environmental issues across the island, but also well-being. So in that work, we came up with some recommendations about how we can share well-being experiences across the island. So the conclusions were that there's scope to develop cooperation on well-being, because both the North and the South are doing work in this area. And there's the potential to use the wellbeing frameworks that have been developed as a tool to engage with a wider range of stakeholders. Are these the right issues? What adjustments should be made? How can we measure these things? And in that space, we kind of encourage cooperation between the Central Statistics Office and the Northern Ireland Statistics and Research Agency in Israel, in the development and application of wellbeing indicators. And there's already quite a lot of cooperation between personnel there. But of course, the CSO is driven by what's happening in Eurostat, whereas the NISRA are driven by what's happening in the Office of National Statistics in the UK. And Brexit has also caused some fractures there because the ONS is no longer part of the Eurostat suite of statistics. So, and then as well as taking into account north-south, an element into consultative groups and so on, we think it's also useful to have this east-west dimension across the islands because of the interesting work that's going on in Scotland and Wales in particular, but also in England. So I just want to then finish. I know the topic of this roundtable today is about protecting the most vulnerable. And you kind of might ask then, how can wellbeing frameworks protect the most vulnerable? Well, quite clearly, there's dimensions within these frameworks that I kind of listed earlier, and some of the indicators that would reflect the situation for more vulnerable populations and how they can then be improved. There's consultation with vulnerable groups to get what their perspective might be, and also the focus on equity and agency that the NASC have come up with. But just very, very finally then, there's been some work done by Mike Tomlinson and Lisa Wilson. Lisa works for NERI, the trade union research organization, and Mike Tomlinson is a Queen's professor. And so they talk about, they've just published a chapter in a book on the poverty of well-being. And they've analysed the Poverty and Social Exclusion UK 2012 survey data. And there they conclude that there's a need maybe to focus more on reducing poverty rather than on well-being per se, and providing more support for those with long-term illnesses and disabilities. And I think that sets us up very much for the next two inputs on the anti-poverty strategies for Northern Ireland and Ireland. Thank you.
Thank you very much, Helen. That was brilliant. And it fits very well with what Janine said on, it was striking how the percentage of people who are planning for the future, because if you're looking at well-being, then you can see a lot of risk, a high risk of poverty in old age, especially among those who are the most vulnerable and who haven't had the resources to plan. So it's a good combination of seeing what's happening on the ground and the measures that government will use to understand social marginalization and economic deprivation. Our next speaker is Michelle Loughran, who is from the Mental Health and Money Advice Manager at MindWise, and she is, as Helen indicated, going to speak on anti-poverty. It's the anti-poverty strategy for Northern Ireland. I will turn it over to you, Michelle. Thank you very much, Helen.
Shana. Morning, everybody, and thank you very much for inviting me to come along this morning. I'm just going to try and share the screen, although I just have, I think, 3 slides, so I'm not going to go over time, I don't think. Can everyone see the slides now?
Yes, Michelle.
See the slides, okay? All right, brilliant. Okay, thank you very much. As I said, my name is Michelle Loughran. I work as the manager with the Mental Health and Money Advice Service within MindWise. We're a mental health charity, and we work with people who are, well, probably quite the most vulnerable people in our communities. And most of our referrals are coming in from the mental health facilities within the Trust in Northern Ireland. So a lot of our people have been long-term detained for mental health care and then are coming back into the community. So we have a very vested interest in people who are vulnerable. But in addition to this, I sit on the board with Advice NI. And I had a very long relationship with Advice NI. I think it comes part and parcel of the job with doing any sort of debt or benefits advice within Northern Ireland. Going back to October 2020, Advice and I were asked to join a co-design group to participate in bringing together an anti-poverty strategy for Northern Ireland, as referenced in the New Decade New Approach Agreement. So as a serving member of the board within Advice and I was asked to represent the independent advice sector. We sort of had COVID, and so there was a lot of discussions. Everything was done online. It was amazing actually to see how many groups actually became involved and participated and came together. And we didn't know at that time the crisis that we're facing now. We didn't know just how bad things were going to get. So the group was made up of other advice, voluntary and community sector groups right across Northern Ireland, working together to put a strategy in place that would look to end poverty in Northern Ireland. The strategy would be evidence-based, take account of lived experience, meaningfully tackle inequalities and obstacles that directly affect the lives of people every day, of all ages, including children and young people who were living in poverty or maybe likely to become a victim of poverty within Northern Ireland. So there's been multiple meetings, lots and lots of meetings and discussions have taken place. Research has been done, various groups have come together, and we've had lots of negotiations. We met with all the different statutory departments. We put ideas together. We received replies and responses, all quite positive, with the overall enarching difficulty of budget as we expect. And we made lots of recommendations and changes to a lot of the conversation, which caused a delay in the production of a final report. But there was a need for that, and we weren't the only strategy that found themselves in the same position. The position paper recommended 6 key asks, so there were 6 key recommendations asked for consideration. Those asks included an Anti-Poverty Act for Northern Ireland, eradication of poverty for young people, for working age people, for older people, increased safe environments in more deprived areas, access to public services, quality that was there and was, quality public services that were there and were timely. The recommendations came from research and produced evidence in all areas of concern and carried out by multiple organisations across Northern Ireland. Further address poverty, housing, rural poverty, transport, children, childcare, access to independent advice, and so much more. And it was very much recognised that the strategy would need cross-departmental involvement. So after quite a lot of work and a lot of input, the report was finalised and sent to the Minister in February. And then we had a meeting in March. Minister Hargey met with us then in March and told us that she very much welcomed the paper, and it was something that she was very much committed to, and would take forward the recommendations. So obviously then we had the problems within our government, and everything sort of came to a standstill. But as a group, we've continued to meet, and we will continue to meet and discuss further issues in a changing environment, very much so. We're looking at, a crisis. We hear something every day. We're looking at businesses closing, interest rates going up, energy costs, you know, so much that it's impacting on everyone across the communities. But we are hoping that the full report will be published in the not too distant future, and we'll be able to send out the full report for everyone to have a look at. But we feel that's essential to keep the momentum going with regular communications to and from the Minister until government are back in place, and they're able then to make the required decisions. So that's sort of the position that the anti-poverty strategy is sitting at the minute. From Helen's conversation, the wellbeing framework in Ireland is very similar. You know, it's good. It's not good, but it's we can see you know, where the whole country is. The problem areas across the board are all similar. I had the pleasure actually of talking to Mike Tomlinson, who did that report that Helen talked about in poverty and wellbeing, and an interesting read for anybody who's interested. Happy to take questions. I didn't even move on my slide, sorry, but there wasn't. It was just sort of like giving you a synopsis of what has gone on. But happy to take any questions now or in the chat. And I apologise, it's I have no sort of results or decisions that I can share with you today. They're very much on hold for the time being.
Michelle, is there anything you can share about the outcomes within the strategy, or is it confidential at this point?
It's confidential at the minute. We're not allowed to share. I sort of give you maybe more than I should have, even within that, you know, with those themes. But and as I say, you know, the framework that Helen talked about, there's a lot of similarities there. But it'd just be great to get this paper out to people to see it, you know. But once we've got the go ahead, certainly it will be put out as soon as we possibly can, Fiona.
All right, thanks.
Thank you very much. I really appreciated that, because it shows what's being prepared on the ground to help people. And I think that's quite important, even if you can't share the outcomes yet, Michelle. And I also think it's great because we're going to go to Paul Gunnell, who's the director of the European Anti-Poverty Network, and he can speak about what's going on in the Republic of Ireland, because it's important to consider what measures are being put in place, not just for temporary support, like a reduction in the cost of transport in the Republic or a one-off payment to reduce electricity bills, but also what's being put in place for the long term to make sure that we're going in the right direction in terms of vulnerable groups and social marginalization. We don't want this current crisis to lead to worse problems. So it's important that we understand how policy connects to services on the ground and how we measure impact. So Paul, I'm going to turn it over to you, if that's okay. Thank you, Paul.
Thank you very much, Shana. Can people see my slides? Okay, very good. Thanks very much, everybody. My name is Paul Gunnell. I'm the director of the European Anti-Poverty Network Ireland. So just very quickly, the network is made up of about 170 local and national kind of groups working against poverty across the country. And also we're part of the European network that have 32 national networks are part of that network. So we obviously operate at the European level as well. Just to give some context, I suppose I was asked to present, I suppose my understanding, I asked to present around the roadmap for social inclusion, which is current kind of anti-poverty social inclusion strategy here. So a lot of my slides are focused on that, but hopefully I'll have time at the end to do a little bit more analysis of what's going on and in terms of the reality and what's needed to address it. Just in terms of anti-poverty strategies in Ireland, that for the last 25 years, Ireland, the Republic of Ireland, has developed anti-poverty strategies driven by what's happening at a UN level and then at a European level as well in terms of need for poverty strategies. The first one, as I said, National Anti-Poverty Strategy in 1997, followed by the National Action Plan for Social Inclusion 10 years later. And then currently we have the Roadmap for Social Inclusion, which started in 2020 and runs to 2025. just all of them have had headline targets, and then there are more detailed targets within them. So it was a kind of few years into the National Anti-Poverty Strategy when the first target was adopted to reduce consistent poverty in Ireland at 2% by 2007, or ideally eliminated. And just consistent poverty, for those who don't understand what it is, are those who are both living below the poverty line and experience material deprivation. They're in consistent poverty, so when those overlap in people's lives. So that actual target of 2% has continued right through to the current roadmap for social inclusion. So it's still the same, effectively the same target, although the goal to eliminate it has been removed. It's down to 2% or less in terms of a target, because it was felt it was statistically not actually possible to eliminate it. So that's why that changed, but it's never been achieved. The target hasn't been achieved. And alongside the main target, then there are other targets, for example, child poverty, which currently exists as well, and a European level targets in the current roadmap. Just a quick kind of overview of the strategy. Just it has 27 targets, 7 high-level goals, and then 69 commitments. So I've explained a little bit in terms of the overall target in terms of reducing consistent poverty. And also then there's a target in terms of making Ireland one of the most socially inclusive states in the European Union, bringing it to the top 5 in the EU. And then there are a range of other targets. I have them there. I'm not going to read them out in detail, but they cover a lot of areas in terms of poverty itself, deprivation, and then in relation to a range of different services areas, also specific targets around employment for people with disabilities in relation to child poverty, and then a number of other areas in relation to social participation. So there are 22 targets overall. Then the 7 high-level goals, they cover a range of different areas, including access to employment for all who can work, ensuring that work pays in that context, and the idea of our commitment to fair pay and fair working conditions, income security for older people, reducing child poverty in the broader context of supporting families, reducing poverty among people with disabilities, helping them to maximize their ability, and it's quite a big focus within that as well, on employment for people with disabilities, and then inclusive communities and encouraging active citizenship, and finally then ensuring all people have access to quality services. And that's what, like I said, looks at areas like housing, health. It talks about issues in relation to food poverty, and targeting issues around energy poverty and climate change, although the issue of climate hasn't really been addressed in great detail within the strategy. And then there's a structure in place at national level to monitor and ensure its implementation. So the key one, I suppose, is the Roadmap for Social Inclusion Steering Group, and that's mainly government departments represented on that have a role in relation to delivering on the commitments, and 3 external people from the community voluntary sector, including myself, and it's chaired by Minister for State Joe O'Brien. And then there are structures in place both across departments and across a ministerial level in relation to trying to drive that and making sure there's oversight in relation to how it happens. There's a particular section that's been in place in the Department of Social Protection with responsibility for coordination across government, which is very challenging in terms of that role, trying to drive across government strategy from within Department of Social Protection. Then there is reporting process, annual progress reports. There's been 1 so far up to September of last year, and then a report card, which is mainly a summary of how overall the government is doing in relation to the commitments and in relation to the targets. Important measures that have been in place for quite a while are poverty impact assessment of all policy to make sure it's consistent with delivering on poverty reduction targets, and then equality and gender proofing across, mainly in relation to government spending. The particular process focuses on spending and how particular departments are targeting particular groups in relation to equality. That process started under the last government about 6-7 years ago. It's taking a lot of time really to embed and to make progress. It's making very slow progress really. And then after budgets, there's an assessment of the social impact in terms of poverty and equality of the measures. Just to say as well that there's an independent midterm review this year. I'll come back to that a little bit from our own point of view in relation to that. But that's very key, because when the strategy was developed, a lot of organisations, including ourselves, identified a lot of gaps within the roadmap in terms of how it's focused and how it's formed and so on. So there's a commitment this year to review the strategy. So that will be important to see how that progresses. Just in terms of the first progress report, which I said came out in September last year, there's another one due out in the next few months, just covering all of 2021. With 69 commitments, it shows that 14 are fully achieved, 17 achieved ongoing delivery, and then others are at various stages in terms of delivery, either in progress or delayed to some extent. 5 yet to commence and 2 deferred due to pandemic. So just within that, I suppose we have questions, and a lot of organisations have questions over those that are commitments that are down as being fully achieved, because a lot of those that are fully achieved are related to publications of strategies, setting up committees and so on. So they're not outcome focused. They're actually related to something that's started as opposed to something that's come or been completed or has an impact. And I think that point has been made well to the government and Minister Joe O'Brien through the steering group members. And I think it'll be something that will be looked at in the review. Just in terms of progress, I suppose, overall, in terms of poverty trends over the last 20 years, basically in relation to progress towards achieving poverty outcomes, that the top line is in relation to material deprivation. So you can see the one that the orange one, which rises sharply and then declines. It rose sharply during the last economic crisis and it's declined now. So there are 13.8% of the population in material deprivation, those that are unable to afford at least 2 of 11 basic essentials. At risk of poverty, at those below the 60% poverty line, it's been reducing over the last number of years. So 11.6% of the population were at risk of poverty in 2021. Just the last below, you can see that the research showed from the Central Statistics Office that the COVID income supports which put in place had a really positive effect in terms of helping keep poverty down or reducing poverty, as without those supports, there would be nearly 20% of the population at risk of poverty. So it just shows the important role of adequate income supports in terms of helping reduce poverty levels. And then in relation to the bottom line, which is the consistent poverty level, those who are experiencing both, those who are at risk of poverty and experiencing material deprivation, the government's target is 2% by 2020 or less by 2025. It's at 4% now. So obviously, as I said, the role of the COVID income supports in 2021 had a real positive impact. So we see when those now have been removed, what the long-term implications are in relation to that. But I think in a sense, it's good to see progress, and it's good to see that overall poverty levels, according to CSO, have been reducing. I just show in relation to some groups, though, that there are serious concerns in relation to when you look across society at the particular groups that are impacted and of high levels of poverty and social exclusion. So we can see in particularly families where they're headed by unemployed people, those who are unable to work due to health problems, where no one is at work in the household, single adult households with those under 65 years of age. And particularly if you look in terms of material deprivation, although they're high across all measures, are one adult households with children, so lone parent households, very high levels of poverty. And the CSO in its publication of the 2021 Survey of Income Living Conditions looked at households that are experiencing great difficulties in making ends meet. It highlighted that 1 in 20 households have great difficulties in making ends meet, but that was 1 in 6 for lone parent households. So there is a particular problem there, but it's an issue across a range of households, including households with people with disabilities. Also important to highlight is the official statistics don't capture the reality for some groups in society, such as travellers, migrants, and certain homeless people and so on. And specifically people with disabilities, it focuses particularly on unable to work through the health problems. It doesn't specifically pick out people with disabilities, although we know that people with disabilities experience very high levels of poverty. Just one thing, I suppose, from particular experience, what we're noticing as well, although the trends overall are positive in terms of poverty levels, what our members on the ground have been noticing pre-COVID, which got worse during COVID, and even now, is that many families are really struggling in terms of making ends meet and depending much more so on food banks and community organizations to meet those needs. So it's a particular issue for organizations on the ground to have a role in terms of social inclusion. They're spending a lot of their time and energy in meeting basic needs of families in terms of food and other basic essentials. But it's also something that we're seeing becoming normalized. And I know in other countries, including the UK, that issues around food banks and people's dependence on these organizations for meeting basic needs has become more normalized. So we're currently doing research supported by TASC to really get and understand what is happening in communities and how can we address the structural issues that will make address kind of people's needs at a structural level without people having to depend on charities and community organizations just to meet their basic needs. Finally, just I highlighted that the review of the roadmap is going to take place this year. So there are some issues that we want to highlight in relation to how that happens. The first is we want to have ambitious targets and clear targets, and there's currently a range of confusion around the targets in terms of what they mean and how they match each other. But also that if we have a strategy, and that's been an issue across a range of strategies, that is aiming for ambitious poverty targets, that the strategy measures must be able to match that. Currently, they're often what departments are willing to contribute and often don't match the commitments, so that needs to be addressed. Also, as I highlighted, there are certain groups in society that experience very high risk of poverty, so there's a need to ensure that measures also target those groups as well, and that we leave no one behind. There are gaps, as I highlighted earlier, within the roadmap, particularly in relation to how current climate transition measures are addressed and ensuring that I suppose those in low incomes, particularly in society, are protected and supported in terms of making that transition and are not negatively impacted. And also, I suppose that we need to, the current roadmap is weak in relation to addressing issues of income adequacy. We need a very comprehensive integrated strategy. So issues of work and decent pay within work are important. Also in terms of investment in services, Ireland is a very weak infrastructure in terms of public services, but also at a very basic level, we have to ensure that everyone has an income which enables them to meet their basic needs. And currently the roadmap is very weak in that regard. And then also overall, I think in terms of outcomes and implementation, that's very clear. So we need to be measuring the achievements of the roadmap and social inclusion strategies in terms of outcomes and their impact in terms of reducing poverty across society. Thanks.
Thank you very much, Paul. I thought that was great. And that's a nice conclusion to the panel in the sense that you're showing there have been considerable efforts in the parts of the government, two governments, the UK government and the Irish government, to help those, particularly those who are in jobs or unemployed, survive the pandemic financially so that they didn't go into poverty. There was a great, admirable, reinforced effort to avoid risk of poverty during that period. But now we're seeing with the cost of living crisis, and if I can mention a TASC report that just came out on inequality, that those who are at the lower income groups in our societies, they are at risk because of the cost of energy and the cost of food, of not just going into poverty, but going into sort of desperate poverty where they are reliant on food banks in order to survive. And we don't want that. I've seen that. I saw that in the UK after austerity, where they become normalized. Okay, well, you don't have enough to eat, well, you just go to the food bank. You don't have clothes, there's another charity to help you out. And I'm assuming that those here who are representing charities don't want to become the source of support for people who are desperate. I mean, especially in wealthy countries like the UK and Northern Ireland and in the Republic of Ireland. There's no reason why charities should be helping people to survive week to week with food. So I think that that's part of the strategy that has to come out of this, is how not just policy, but also in practical services, people are not resorting out because of desperation, because they can't afford basic necessities, on the voluntary sector or community organizations. Anyway, on that note, I will say thank you to all of our speakers, and we will take a short break. If we could just return at 11:10, if everybody could do that, just to take a short break to get a cup of tea, use the facilities, and come back, and we'll go into our breakout rooms. If you have any questions, please contact us. Thank you very much. Thanks to everybody.
I'll try to sum up a few of the ideas from my group, although that's quite difficult. And I'll ask Sinead and Fiona then if they want to add kind of anything before we wrap up. So in our group, we talked a good bit about the cost of living crisis, and it's a kind of common issue across both jurisdictions. We also kind of talked about what has happened kind of post-pandemic, particularly the kind of stress that's been put on people when supports have been removed. So the pandemic payment in the Republic of Ireland, and also there is more evictions as they were paused during the pandemic, but people's kind of wages and ability to pay for services hasn't really caught up since then. We also talked about fuel being kind of a common issue as well, the cost of fuel. And we did talk then about some differences, particularly around housing, how housing is kind of different because of regulations both sides of the border as well, but it is a concern for both. One thing we talked about as a kind of possible area of cooperation was the idea of like having a social wage, really putting kind of more kind of pushing to put more money into service provision, as opposed to kind of particularly in the Republic, the cash transfer system that we have here, to have pushed to have services more thoroughly kind of robustly funded, because it's very hard to keep up with inflation. So that was what we talked about in our groups. If I could ask maybe Sinead, just because I'm looking at you now, if you had anything kind of different or anything you wanted to add in your group.
I suppose really joining on from what you're saying, it is like we talked a lot about like energy efficiency of the houses and the actual market that we have, and you know, if you were able to heat homes that kept the heating in, it would reduce costs, you know, cost of living, household incomes as well. You know, Janine was in our group and she talked very much about like now people are not going to be able to save, that resilience goes, they're living hand to mouth, you know, and then you have the bigger long-term effect of retirement, cost of care, everything else. So that is a major concern. We talked about the increase of destitution, those struggling, you know, we are looking at a recession at some point, you know, and then it's writing policies of how do you include everybody, because that's difficult. We talked a lot about, you know, benefits and the minimum essential living. These are not you know, and it's both sides of the borders. We talked about this, where like benefits do not sort of equate what it takes to live in society today, and that was a big sort of message going out on a campaign really on both sides of the border. People aren't able to budget, so a lot of the stuff, we have negative budgets coming through in the debt advice service, you know, and this is only going to increase. Northern Ireland has the political divide going on, and we have no government, and potentially will have no government for quite some time. So that is a big concern in Northern Ireland. You know, the other thing is a lot of the strategies, we know what the strategies are, all the evidence goes into these lovely big strategies that are published, but it's the coordination and the actions and the accountability behind that are missing. Now, Janine talked a lot about, you know, Wales having a really good model, and it should be the ideal model where they're working collaboratively across their government, and it's potentially we could, you know, do an exercise of looking in, well, why does it work so well there? You know, it's all about bringing them together, and they've put a funding pot together that they use for the strategy and whole. So it's not all different things coming across and people taking the lead. So it works really well there. And, you know, they've talked about the likes of reducing red tape. You know, there's one advice fund, every child matters strategy, everything they work collaboratively together with, and it works. The other thing would be looking at opportunities, you know, looking at the fact of having more like a lead responsibility in different things that cuts across, more responsibility, you know, looking at the likes of the COVID support that was about and how people were buoyed up. So it's nearly, as we talked about, the deserving and undeserving, because benefits is paid at a much lower rate, yet the COVID strategy paid at a higher rate, that people were able to live basically essentially paying debts and all of that. So why was the difference there? You know, the other thing would be sharing information across the two jurisdictions. What works well? How can we work better? You know, if we're further on in a strategy, share what we've done and the learnings from it. If where another jurisdiction is only starting out together. So in a nutshell, that was really what we talked about. And if anybody wants to add anything within that, please. The other thing would be around influence and collaboration, bringing together organisation, having joint messages, clearer messages, going to government with the same messages, knowing and understanding what the issues are, and having a common approach, which is happening in the South really well. And I think, as Paul said, it was the St Vincent de Paul has held recently a really good meeting between sort of key stakeholders so that you can influence at the higher level, but coming together with that joint message.
Nice. Thanks very much, Sinead. Do you have anything to add, Fiona, before you wrap up as well from your group?
You've left our group about a minute, Sinead. I'm only joking. So again, really good discussion in the group I was in as well. Some of the key messages coming out of it were around the need to separate the short-term and the long-term issues, and that the government needs to look at these and address those. Also, a comment in relation to that was that it's difficult to get the headspace to look at the long-term solutions right now with the crisis that we're in relation to the cost of living, the supply chains being impacted and impacting on the increase in prices. Also, the food poverty issue that we're facing, and a food crisis that's really going to hit us hard with the climate change in Spain, Australia, other areas around the world, and the impact that the war in Ukraine is having on supply as well. There was some of the interventions that have been provided to date have been a real sticky plaster approach to things, and there's a real need for real money to go into real people's pockets. There's a need for benefits to increase, a need for employers to look at living wage options, and Advice NI is a living wage employer and is looking at doing more work around that across the north. Bob in Advice NI is involved in the Northern Mutual Bank, and he has suggested that, and they would suggest in the Northern Mutual Bank, that there's a need to develop a circular economy where we can reinvest into the environment and environmental issues and the social economy, and that it would be really good if we were able to develop and build a mutual banking across Ireland to support and develop that circular economy for the island as a whole. A question around how do we develop a sustainable economy in Ireland, and what needs to happen to do that, and that's kind of central to that kind of point about the mutual banking and anything else. Other points were around one of the biggest issues of social exclusion is immigration. Those that have no immigration status can't do anything. This is hampered by the issues around the legal aid system in the north and the rest of the UK. We're not totally sure what the situation is in the south, but with inadequate benefit system to support the long-term, short-term and long-term needs of people, and no legal aid, no fit for purpose legal aid service. It's not giving the tools to people to meet their needs and to challenge and address problems affecting them. Again, mention of the sticky plaster approach and the cost of the sticky plaster approach in the short and the long term. It actually costs more in the long term to fix what isn't being fixed by that approach. Issues that are thrown up around the common travel area are also causing exclusion. So in relation to that in the north and south, if you don't have status, then it presents a lot of issues in terms of movement. The issue around digital exclusion and the assumption that everyone's online and the move for everything to be digital first. We had examples of the EUSS, the Settled Status Programme, whereby it was completely online, but then there was resources needed to support people to use and access the online services, obviously with the issues around data skills and the equipment. So if you've no data, you're more excluded. If you're choosing between heating and eating, you're not going to have data. And then a comment around the people aren't hard to reach. It's the services that are hard to reach. So in terms then of solutions, we would want more cross-border working and understanding around all of the areas and around digital inclusion as well. We think that the wellbeing frameworks that have been developed could be integrated across the island. The government in the north is focusing on outcome-based accountability for any funding that they're releasing this time round. So it'd be useful to compare and contrast some of that stuff. It would be useful if there's lots of strategies out there. It would be useful if they were interrelated and integrated in terms of their delivery. We think that we could, as a group, form a Leave No One Behind and Access for All campaign. And I think that would be a really powerful thing if we could do something like that across the island, and include those with status issues in that where we can. So a real good all-rounded discussion that touched on many different areas of social exclusion and some of the issues. But what I got from it as well was that this has been both events have been really useful, and it would be really beneficial to continue with events like this to allow for sharing of information, updates on what's happening, and even if that was themed around particular issues, that would be really beneficial. And there are other things that are happening, I think, with NICFA and the wheel, but and they're really useful and beneficial as well, but that doesn't take away from having other events like this that bring different sets of people together, perhaps, to look at some of the issues as well. So thanks to everybody that participated in the discussion group that I was in.
I think, Fiona, you're going to just say a few words now to kind of wrap up. And
yes, okay.
Sorry,
we're at that point. We are indeed. So basically, just to thank everyone for participating and taking the time out from your working day to join us. I think we've certainly learned a lot from the last two events, and we wanted to thank the Community Foundation who funded this particular piece of work, and Advice NI would like to thank TASC because they asked us to join them in the funding application and to partner with them. So we're looking forward to building further relationships with TASC going forward and hopefully to have an impact across the island. Obviously in the north, we are sitting in a kind of limbo stage with government again, and we're not sure when that will turn around or won't, so that puts a bit of delay on things. But Advice NI still does the work that we do in terms of trying to shape policy, addressing poverty issues, debt, welfare reform, supporting people with immigration and settled status issues, and with tax and benefits and welfare reform, and supporting our members to do that. So we are keen to keep the lines of communication open with anyone that's participated in any of these events, and are really keen to continue to work on a cross-border and all-island basis. The next steps to this piece of work, I suppose, are to combine the learning from both events and develop a short policy brief. And we would hope to share that policy brief with everyone that has attended both events and to give you an opportunity to add to it, to amend, or to feed into it in whatever way you see fit. We would hope to be drafting that policy brief later on in the summertime, with a view to having it completed in September. And we'd obviously be keen to have your feedback and input into that. So just to say thanks again to everyone, and thanks to TASC, Shana and the team especially, and to everyone who participated in the event, and to all of the speakers today and in the last event. You really did share a wealth of knowledge with us, and it really laid the foundation for good discussion in the working groups. And I think it's fair to say that everyone had a lot to say and participated and engaged in the process well. So thank you so much, everyone, and thanks to Sarah for all her hard work in pulling this together. So look out for us on Twitter. I think there's going to be hashtagging on Twitter feeds from TASC and Advice NI. So please do feel free to retweet and follow both organisations on Twitter and on our Facebook pages, and do have a look at our websites as well. And if there's any areas that any of us can work with together, please don't hesitate to contact us at TASC or Advice NI. So thanks again. Thank you so much.